Heather and Steve did an excellent job of keeping within the 3-minute time frame, and because we have Rocky Galassini and Gloria Bailey there, our timers, and what Rocky is doing, she's holding up a 60-second time frame for them, 60 seconds left, and then 30 seconds, 15 seconds, and please stop. And Rocky, being so creative, does that in red as well. We all notice that. All right. Has all the audience, have you had a chance to get your questions in yet? When you came in, everyone got the questions in they wanted to? Yes. If not, you might go towards the back and see if there's room for more questions back there. All right. Now we're going to get into the questions this evening from the Republican Party of Otero County for our candidates. And we have 5 questions. Are we going to do a coin toss in this too? Okay, we're going to go 5 questions. And the first question is, and who's going to go on this one? Heather or Steve? The first question is, 74% of Americans are disgusted with the healthcare system. 70% of the Americans feel providing health care for Americans is more important than holding down taxes. What is your solution to the healthcare problem, and would raising taxes be a factor? One of you, who wants it first? Heather. All right.
A lot of small businesses are struggling to continue to provide health insurance for their employees because of rising costs. The answer is not socialized medicine, which is the ideas being put forward by Senator Obama and Senator Clinton. I'm a strong believer in a private sector solution with a safety net for the elderly and the uninsured. Association health plans that allow small businesses to band together and they can get the good rates that big insurance companies can get. I also support things like refundable advanceable tax credits, so people, individuals, can buy health insurance and do it with pre-tax dollars. I would also disagree with something that Steve said in his opening. The Children's Health Insurance Program has been in place for 10 years, but it has real problems. You don't have to show you're an American. We have a lot of states with adults, and you don't have any cap on income. It was up for reauthorization this year, and I thought we needed to fix those problems. The bill I passed required you prove you're a citizen, phased out adults, and also said we got to put a cap on income. Unfortunately, we had extremes in both parties who demagogued this to death, and we weren't able to get people together for common sense solutions. And what did we do? The Congress passed a bill, because we couldn't get consensus on fixing those problems, that extends the current program for another 18 months, adds over $1 billion more, does not require you to prove you're a citizen, does not phase out adults, and puts no cap on income. I think that defies common sense. The Children's Health Insurance Program is a cost-effective way to provide insurance for low-income children, and they should be limited to that. I will continue to fight for that kind of a children's health insurance program.
My wife and I ran a small business. We had to buy health insurance every year for our employees. We saw the escalating costs. We saw the distress in our families. I will tell you that with all the cost increases, if you think that medicine is expensive now, wait until it's free. We do not need socialized medicine. We do not need government medicine. I will tell you one important difference between the Congresswoman and myself, and I say with all due respect. This S-chip program, she was just saying, had a $71 billion tax increase in that to pay for it. Now that begins to answer the question, will you vote for tax increases to pay for increased medicine coming free from the government? And I will not. I have proved that I will not, and the ratings from Americans for Tax Reform say that I will not. What we need to do is encourage the health savings accounts whereby people can put money into an IRA. We already have that plan. We need to encourage that. We need to get more young people to buy into medical insurance because young people are evacuating out of insurance, and when they leave, they take the profitable piece of the health insurance program away. We need more investment in the National Institutes of Health. We as Republicans have more than doubled the money in the National Institutes of Health in order to research and to catch problems up front. We need more preventive medicine, not wait until it's catastrophic. Our government agencies wait until it's catastrophic. So in the prescription drug Medicare revision plan, it was for the first time ever Seniors could get physical exams, they could get preventive medicine. Treating the things up front causes it to be less expensive and makes our dollars go far. I will always support the private plans that cause people to come to this country seeking our medical care. I will not support the government plans, and I will not raise taxes in order to fund any of the plans. We have plenty of taxes that we've already collected from you. The government does not need more of your tax money. They need to spend the money more wisely that they have. Thank you.
Sure.
There are some things that Steve and I agree on. We do need to continue medical research, and the medical miracles that are available today. I mean, you think about it, in 1965, a diagnosis of cancer was a death sentence. And the reason it's not today is because of advances in research in medicine, particularly pharmacology. And I support that research as well. Like Steve, I support an emphasis on prevention. The insurance system that we've all grown up with pays for incidents of disease. It doesn't help to keep people well, and that focus on wellness is a much better approach. I also support and voted for health savings accounts. I would say two other things, though. One of the things we have to do is get malpractice liability reform. Malpractice costs this country in tests that are unneeded and in doctors who will no longer practice. I know a doctor, talked to him a while back now, in the South Valley of Albuquerque, who pays $125,000 a year just for his malpractice liability insurance. $125,000 a year. Before he opens the doors, pays the first nurse, we need malpractice liability insurance to help keep the costs down. I would say one other thing to Steve. You say you don't support the government plans. Does that include Medicaid and Medicare and S-CHIP as we know it now? Because those are the safety net, things like community health centers. And the taxes that he refers to in the children's, that have funded children's health insurance since it was started, come from cigarette taxes. I have never had an objection to cigarette taxes, and I hope it causes more young people to stop smoking. Thank you.